morning, everyone. I'm Marie-France Hivert. I am the chair of the program committee for this year Epi Lifestyle Conference here in Boston. And I am very excited after our opening session where we had the chance to listen to 3 outstanding keynote speakers. We had over 890 registered participants to join us in person, but for those of you who have not had the chance, I'm gonna have a quick interview with each of our keynote speakers, including Dr. Mattei here. Our theme this year is implementation science, and I would like to give the chance to one of our keynote speakers to tell us a little bit more about implementation science in her research. Tell us a little bit about yourself and the summary of what you presented today.
Of course, thank you so much for inviting me. I'm very glad to be here at AHA, Epi Lifestyle again. So my name is Dr. Josiemer Mattei, and I am an associate professor at the Department of Nutrition at Harvard Chan School of Public Health. And I'm a nutrition epidemiologist by training, but as I was going along with my career, I noticed a lot of that research that was coming out wasn't really translated and being applied to the communities that we really needed the most, including Hispanics. I am Latina, and I saw that in my community on a daily basis. So that helped me and encouraged me to continue and move on to a more translational piece of research. And I did my MPH as well and started applying our work in public health. So now, along with my hat as a nutritional epidemiologist, I wear my public health nutrition hat and working that translation piece and moving into these 2 fields. And we take the evidence that we get from epidemiological work, translate it into programs that are centered around the cultures, the values, the foods of communities with the goal of preventing heart disease and getting them to eat healthier within their values.
And tell us some of the lessons you've learned along the way, because as you told us, it's a journey.
It is. It is a journey, and it's something that I always remind everybody that it's good to start having a vision and start planning for that vision early on, because the process of translating and implementation, which is the topic that I presented today, implementing this in real life can take time, and our projects have been in the works for years. We started this 10 years ago, and we're just in the middle of the road with plans to translate and disseminate this further. That is going to be another 10 years. So yes, it is a long journey, but it's definitely a worthy one, especially when you work in the communities that you care for.
Can you tell the audience a little bit about the exact project that you've been that you presented and you've been carrying all through those years?
Of course. So today's talk was about real life implementation, and it bridged that the 2 talks in between what is implementation sciences and then how we get into policy. So we talk about a couple of examples of how we have been taking evidence-based programs and putting that into action for the benefit of the community. I started by providing one example with the diabetes prevention program that is now being rolled out nationally through the CDC, and that has been incredibly at reaching out to people in the United States, but also where the gaps are in talking to or holding on to participants who might not have the right resources to attend to these programs and to stick to these programs. So then, to see how do we overcome these barriers, I provided the example of the Mediterranean diet, which has been promoted. There's very strong evidence around it. It is promoted by the Dietary Guidelines for America. And one thing that we have noticed, though, is that when we're doing our work with our communities, they might not eat or might not be familiar with the foods that are in this pattern. So we talked about how we've been adapting this in Puerto Rico, which is a community that has social and health inequities. And we went through the process of learning more about the foods that would still fit with the Mediterranean diets and would still be healthy. We did cultural adaptations around those foods, but also around the messages that spoke to the food that they wanted. And the culinary techniques that would be important for them and the values that they put on the foods and the family and the culture. And then, what metrics we can use to then assess the effectiveness of these programs. And then eventually, can we take that to policy? And there are other programs out there for the southern US, for Native Americans that are also implementing programs. And all the lessons that we've learned from that journey.
And if you had one key takeaway, what would that be for our audience?
Stick to it. It's hard. It's a hard journey, but it's definitely a worthy journey. And definitely work with your community, know your population, know them deeply, do your formative research and use that to do a program that speaks to them and that is centered on their values and it's centered on their culture, and that it's going to have it's going to be of value to them beyond the health. Thank you.
Thank you so much for your presentation and your time today.